All right, so in this video, I'm hoping to demonstrate and show some of these gait deviations that I talked about. And so the first one is the knee extensor thrust at initial contact. And this one, again, we're looking at that knee joint. So hopefully you can see this at this angle right here. But again, in a normal gait cycle, what usually occurs is you have heel contact. And again, you have that knee flexion going on through most of the stance phase, and eventually extension to prepare for toe off. But in this case, the knee extensor thrust, what goes on is you have initial contact, and you have a tiny bit of knee flexion, I guess, but then the knee goes into hyperextension. So what you kind of have is extension of the knee when there's supposed to be kind of flexion, especially in that stance phase. So which is right after heel contact. So again, kind of goes like that. And again, as far as treatment goes for this, this is primarily due to spasticity of the quad or the knee extensor. So we kind of want to focus and treat that spasticity, whether that might be through stretching or using the TENS modalities, whatever measure may be. And again, another thing we want to really take a look at is we want to make sure that it's, or at least differentiate if it's from a plantar flexion contracture compensation as to why the knee wants to hyperextend. And so if that's the case, then we want to really improve that ankle range of motion, stretch it, maybe use a joint mobs. Another thing to pay attention to is with this gait deviation, we see a lot of hyperextension at the knee, so we really want to be cautious and take care of that posterior capsule because it might be overstretched or weakened. And so the second deviation was at the hip. So this is a forward trunk bend during mid and terminal stance. And so again, usually during the gait cycle, what goes on is you have 30 degrees of hip flexion at heel contact. And again, you kind of flex, and then during the mid to terminal stance of the right leg, your hip starts to extend so that it can clear and prepare for toe off. But what goes on in this situation is, again, it's kind of most likely due to hip flexion contracture, so you're unable to extend that hip during that mid and terminal stance. So what occurs instead is that you have a forward trunk lean. So I guess the best way to kind of demonstrate this is to go, I'm kind of hyperextended the knee, but main thing is you're not really able to extend that leg, or that hip, so you're really leaning forward during that mid and terminal stance. And again, as I kind of mentioned before, similar to the one before, it's primarily due to hip flexion contracture. So, to treat that, we really want to stretch that hip out, those quad extensors, or the knee extensors, such as the quads. Even use TENS modalities, whatever it may be. And then again, another thing to take note of is that oftentimes that forward trunk lean, it can ultimately become into excessive lordosis since you're leaning so much. So, and with that hip flexion, you have a anterior tilt. So another exercise or treatment plan would be to promote pelvic tilting to kind of compensate or treat that excessive lordosis. So we can do pelvic tilt exercises like abdominal ones and whatnot.